Hello to everyone. It's a pleasure and an honor to be part of this conference. When I got the invitation, I was asking the organizers, okay, but how will you organize such a conference? And actually, it's surprising how smoothly, how everything is going on very nicely. So thank to the organizers and thank to all the technical staff here. Because I'm live here, I would ask you not to be very judgmental. Maybe some mistakes will happen, but the most important thing is the data is accurate, and I will share some data with you. First of all, we live in a world where our mobile devices are not anymore exclusively used for communication. They are used for everything, actually. For translating, for checking the time, for some information, for the weather forecast, for whatever we can, even for some maintenance of our homes and other stuff in our flats or apartments or homes that are connected to the internet. We are using our mobile phones actually for everything. And that is the first big change that has happened to us. The second change, because we always have our mobile devices with us, we became more demanding, more impatient, more curious. We want everything now. Everything is in our hands reach. And because of that, we are even more using our devices to find out whatever, the address, the directions, the temperature, sometimes even useless information in a sense that they don't improve our current state, but we are just curious, why is this street called by the name of Napoleon, who was Napoleon and whatever. We use our device everywhere for everything. And when you check the online behavior, something very significantly happened. We became people or consumers or clients, whatever, that are seeking only for the best. Nothing is good enough only if it's the best for us. So, for example, the search for best travel pillows exploded. It's rised 3 times in the last 2 years. If you check even kitchen salt, even people searching for kitchen salt, this search query increased for 4 times in the last 2 years. So whatever we buy only the best stuff. And overall, the search for something that is best increased about 100%. We are buying, we are looking, we are interested in only stuff that is the best for us. But there is a pitfall. We are always looking for the best, and therefore we are using the internet more than we are sleeping during the day. Some researchers even have found out that we are online as double as we sleep. It can become a problem. It's for some future problem solving stuff, but it is a process going on, and it is unstoppable. People are online all the time, everywhere, for everything, and that's actually the paradox. People are connected, and it's very hard for us, for everyone in all the industries, to connect with people. Because the number of channels, the number of information, the ability to see anything that you're interested in is so big that we are distracted everywhere and all the time. When I was a young boy, I remember when my father bought the first color TV. All the people in the street came to see this wonder of technique, to see what is going really colors on a screen, and it was a surprise for everyone. And I remember we had one TV set and about 50 people in the room watching a football game or watching some interesting stuff that was going on. Today things are completely changed. Scarce. Reach was scarce and attention was plentiful, and now reach and attention completely changed the position. We have now reach to everyone, but we cannot get enough attention to our product. And even what is more surprising, national borders are not important anymore. At least in Europe, this process is going in a very interesting direction. 60% of people in Italy and Spain, they don't even care if something is across the border. 80% of the Scandinavians, people everywhere in the world expect everything on the net is buyable wherever you are. And this process is going on. There is a significant change in behavior, a significant change in demand, and a lot of, especially medical tourism facilities, are trying to catch up because now the first contact is usually online. You can, and you have, there was an explosion of these online services like Zoom, like Hangout, Google Meet actually, and others, because people have the first contact and want to see a person, not a robot, answering questions. And because of that, a lot of online communication has been established that in a way supplemented the physical behavior. And the COVID just added some additional accelerators to this process. What has happened? People were, of course, interested in buying only the best. But now it's not only the best. It's asking companies, clinics, or whoever they want to do any interaction. What can you do for me? How can you help me to overcome this strange situation? What is your attitude towards my problems? That was always there, but now it's much more emphasized. Much more people expect companies, clinics, and everybody from offering services or products the answer, okay, but what can you do just for me? Not for the general public, not for all the buyers, but just for me. And the second very interesting thing COVID has added to our behavior changes is what is your brand doing to help overcome these situations? What are the efforts of your company to help us all? And that was a very interesting change of attitude. It's now not only what can you do for me, but what has your company done for everybody else? How can you contribute to this fight against the virus, against whatever is the new normality, so-called? How is your company contributing to overcome these strange new obstacles? And there is a change in attitude. A lot of marketing campaigns, a lot of marketing professionals were educated on the so-called FOMO process, fear of missing out. If you put some fear in people's in your offer, then people's behavior usually is pushed a little bit stronger to the conversion, to the last step in the process. Now FOMO is not anymore the main reason. It's folle. It means fear of losing everything. Okay, if I have some interaction with you, how can you guarantee me I will not lose everything? For example, I buy an airplane ticket, and I want to have a guarantee that I can cancel the flight the last day. If I cannot cancel the flight, I will not use your product. And a lot of companies have to adjust for this new type of behavior. It's not anymore the fear of missing out, it's the fear of losing everything. I pay you something and I will never get the product. I cannot use it. I cannot go outside my apartment, and maybe some problems will be generated by this, and I will lose everything that I have paid. And that is one of the main behavioral one of the main behavioral change in people's attitude, in consumers' minds. Don't give me some guarantee I will not lose everything if I have anything to do with you. Why this change happened? If you check some data provided by Google, it is obvious that the coronavirus and COVID disease is on an all-time high. Never in history happened so many search queries concerning coronavirus or COVID disease. As you can see, it happened in the second half of March this year, where the search queries connected with coronavirus exploded because never before people searched for coronavirus, then it exploded, and now we are getting back to a new normal behavior. It's not so interesting anymore. The second interesting thing is that health in general, so health as a topic, is on a 5 years high. Health was never so much Googled, so much searched on the internet as it has been this year. This can be a good input for everybody in the health industry, because people are interested in, people are showing great interest to things connected to health in general, especially with Corona connected, but health in general has a high demand in people's search behavior. For example, we have a lot of clients that are offering in Italy some dental services, and if you check the period between March and April, there was a almost all-time low in demanding the search in searching in Italy for the search term impianti dentali, but it's bounced back just like nothing happened. It bounced back, and it's if you check the lines, if you check the results, it's almost like nothing happened. April and March and April, if you neglect this data, it's almost completely like Corona never happened before. Very interesting for people in the health industry is, we call it in our company, the active and the passive offering of health services. What is an active offering? For example, you have some surgery or you have some dental services. Somebody is actually doing something on your body, in your with you, and there is this passive health offerings. It's just a run away from your living place because something is bothering you with allergies. You just change the place where you are living, and you will solve some of your health problems, like allergies, bronchitis, and some other things. Some people should avoid strong sun and so on. And when you check this possibility of passive health offerings, this is the data for Germany. Since 2004, the last 17 years, Germans have a very similar behavior concerning diet. Because on December, nobody cares about diet, and in January, there is a great demand of searching for diets. And this year happened something very interesting. In March and April, nobody cared about diet. But now it's bouncing back. So people are getting used to this new normal situation. And whatever happened before the Corona crisis is slowly entering in our lives again. We are used to this Corona changes and have learned in a way to live with them. A very interesting thing is, I mentioned already, bronchitis. If you check, it's also for Germany. In the last 17 years, in February, there is a great demand in Germany for anything connected with bronchitis. There is an explosion of bronchitis problems in Germany, and sometimes the solution is just to change your living place, go somewhere for 15 days or 2-3 weeks, change just your address, and your problems will be solved. And because of that, we had a nice analysis. I will show you the results, but just to show you, bronchitis is very interesting. In February, allergies have also a seasonal peak in Germany. This seasonal peak is happening always in March. In March this year, The seasonal peak was a little bit less than the years before, but as you can see, it happened also again. So Corona didn't change us completely. It just changed or postponed some changes that we have, some behavior that we have in our lives. We just postponed some things for a week or month or a quarter, but in the essence, nothing happened so radically. And well, also the search for diabetes type 2, it has a nice steady growing search query increase. People are interested because the disease is increasing. It's also data for Germany, and if you check, you can check every country in Europe. It's almost the same. This line goes the same, more or less up and downs, but it shows a steady increase in searches. What have we done with the Kvarner cluster? A very interesting usage of Google's data provided by Google's consumer survey. Google's consumer survey is just a questionnaire. When you enter a website, you get one question that is paid 10 euro cents, and it's a price for an answer that concerns yes or no answers. And we just asked people in Germany, did you know that on the island of Maliloshin, people don't have bronchitis? And it was a very interesting question, because what happened after that question? People in Germany started to search Maliloshin bronchitis. That was very interesting, and people in some, we have there some hotels as our partners, told us the increase of phone calls and emails and inquiries during February, when this survey was going on, was surprisingly high for them, because people were searching about Maliloshin bronchitis. That's their problem. And the answer was, okay, we have a nice accommodation for you if you plan to come to Maliloshin, whatever, if you have problems with bronchitis, and so on. But what was for us very surprising, about 12% of Germans that participated in this survey actually said, yes, I know about Maliloshin, and I know there is no problems with bronchitis. 12% of Germans is much higher than the percentage of bronchitis affected people in Germany. So a lot of people in Germany should not be attracted to come to Croatia. Come here, we can solve your problem, but just let you know, these problems can be solved here. It's up to you. And surprisingly, this year in tourism, maybe you have this data, Croatia had a decrease of overall tourists coming to Croatia, but some special niches had an all-time high. For example, villas with pool, family boats, catamarans. They had a really high level of demand, because it was this new normality. Give me something that is closed, where I don't mix with other people, and I will enjoy my holidays, I will enjoy my staying. And I think we should just adjust a little bit, not change our behavior, not change our offerings, just adjust a little bit to the new demand that is happening. And all the data is there. Google is providing, Facebook is providing with a lot of data, a lot of researches that you can check. People in a way postponed, and in a way changed a little bit their behavior, but they didn't change it completely. And that is the point of actually my presentation, and thank you for watching. If there are any questions, I'm happy to answer them. If not, I will be even happier. Thank you.